Hello, this is Dr. Lisa Tran. Dr. Ratner, Dr. Wilson, myself, and our entire team hope you, your family, and your staff have been safe and healthy. The novel coronavirus has changed healthcare forever. However daunting, inconvenient, and challenging this transition may be, we must all keep in mind that we are in this together. All members of the community are being affected by this tragedy. Here's what we know. According to the New England Journal of Medicine correspondence from April 16th, we know that the virus can survive for up to 72 hours on plastic, 48 hours on stainless steel, 24 hours on cardboard, and in the air for 3 hours. As dentists and healthcare professionals, it is our responsibility and privilege to maintain the health and safety of our patients, our team, and ourselves as we move forward. We are used to upholding the highest standard of infection control in our offices. These are the steps we are taking to minimize spread and keep our team safe. Preparing for patient arrival. We have removed all pens, magazines, coffee machines, and water from the waiting room, consult rooms, and reception areas. We keep a log to track reception area and waiting room cleaning. We disinfect high touch points every 2 hours, including doorknobs, waiting room chairs, front counters, phones, keyboards, and mice. We post COVID and hand hygiene signs throughout the office. We have hand sanitizer available in the front as well as all patient care areas. We give every patient a personal hand sanitizer bottle to further encourage hand hygiene. All staff wear the best available face masks at all times. Our staff wear name badges to help patients identify team members. Consider having name badges with staff photos to help patients feel more comfortable. When patients call for appointments, we ask COVID screening questions. Have you had a cough, fever, or shortness of breath in the last 2 weeks? Have you traveled? When patients arrive at the office, they are given a coronavirus questionnaire to complete with signature. With COVID, it's important to be understanding and lenient with patients and allow them to reschedule or cancel appointments as desired without repercussions. Remember to keep a running log of those who have canceled and need to be rescheduled. When patients arrive at the office, we want to encourage them to wear masks. If your waiting room is small, consider having patients call the office on arrival to restrict the number of people in your waiting room and allow for social distancing. We allow patients to be accompanied by one person maximum. Consider having patients and their families fill out paperwork and wait in their cars, or better yet, have them fill out the paperwork at home before coming to their appointment. We remove seats from the waiting room and arrange them to allow for social distancing with 6 feet of space. We are adding a sneeze guard at the front desk to protect our front office staff from aerosols. Front office staff may wear gloves and change them when notably contaminated, especially when handling patient forms and payments. Again, we encourage safe hand hygiene with or without gloves. We've also removed a physical sign-in sheet at the front desk. At every appointment, we take the patient's temperature with a touchless thermometer and document it in the chart. We are also taking the temperature of the person accompanying the patient. If it is over 100.4 degrees, the doctor is notified immediately. Personal protective equipment has never been more important. Each dental practitioner must determine what PPE is most appropriate. Higher risk procedures, one which results in more aerosols and/or more time spent in front of the patient, should be appropriately treated using higher levels of PPE. We are wearing hair covers, disposable gowns, KN95 masks, protective eyewear, face shields, and gloves. It is important to review the sequence for putting on your PPE. First, put on your gown. We want to cover the torso from neck to knees, arms to end of wrists, and wrap around and fasten in the back. Then, the hair covering, either a surgical cap like Dr. Wilson is wearing, or a hair bouffant like surgical assistant Sam is wearing. Next is your mask or respirator. Fit the flexible band to the nasal bridge, fit snug to the face and below the chin. Then goggles or loops for eye protection and a face shield over that. And finally, gloves. Be sure to extend to cover wrists of the gown. To safely remove PPE, start with gloves. Remember, the outside of the gloves are contaminated. Grasp the palm area of the gloved hand and peel off the first glove. Hold the removed glove in the gloved hand. Slide your finger of the ungloved hand under the remaining glove at the wrist and peel off the second glove. Discard the gloves. Remove face shield next, but avoid touching the front. Then remove goggles or loops. Remove the gown from the back. Turn the gown inside out to avoid touching the contaminated areas and discard. Then remove the mask or respirator carefully without touching the front. And finally, practice hand hygiene with alcohol-based hand sanitizer or soap and water. It is more critical now than ever to practice good hand hygiene with hand sanitizers or soap and water. Limit touching the face, nose, mouth, and eyes. For patient procedures, we keep the operatory room door closed to minimize aerosols. We have patients sign a coronavirus treatment consent that discusses the risks of treatment with the known pandemic. We have patients rinse with 1.5% hydrogen peroxide rinse for 1 minute prior to surgery. According to the ADA, coronavirus is vulnerable to oxidation. This will reduce the salivary load of oral microbes. We also try to minimize aerosols when possible. You might consider hand scaling instead of using ultrasonics or Cavitron for the time being. We may have to consider air filtration, air purification, UV disinfection, and negative pressure systems. But there are no current guidelines or recommendations from the CDC, ADA, or CDA. We will have to await scientific data regarding such devices with SARS-CoV-2. Regarding staff, we have our team log their temperatures daily. If they feel sick, we have them inform us immediately and have them stay home. We hope for continued good health of you and your family, your staff, and your patients. Know that we are here for you and encourage you to reach out to us if we can help. We hope you'll join us for our online CE featuring Dr. Alan Sheridan, who will review infection control with the very timely COVID-19 update. Please keep an eye out for an email invitation. Thank you.